Coming up, we'll be on location at Davis Endodontics in North Potomac, Maryland, discussing the benefits of endodontics and how they can help restore your dental health with one of this region's top doctors, Dr. Gail Davis. Dr. Davis received her DDS degree from Meharry Medical College and completed her endodontic training at the University of Michigan, and Dr. Davis is widely regarded and recognized as one of this region's top endodontists. Welcome, Dr. Davis. It's great having you back on our program again.
Thank you so much, ROCCO, for having me. It's great to be back.
Well, we have a lot to talk about. We have some patients that are going to be joining us a bit later.
Yeah.
But I wanted to begin, if I may, Doctor, by asking you if you can please tell us what endodontics is for those out there watching who may not know.
Sure, absolutely. Endodontics is that branch of dentistry that deals with the inside of the root. You know, I get a lot of people saying, what are you going to do? Take my roots out? No, we're going to take the nerve out inside your roots. So when you look at your teeth, you see a white tooth, right?
Yes.
Okay, so next to that, that's called the enamel, by the way. Next to that is the dentin, okay? And then next to the dentin is where you have the nerves, which is called the pulp, which is composed of blood vessels, nerves, and connective tissue. And this extends from the top of the crown to the tip of the root and connects with the tissues surrounding the root.
Oh, very interesting. And that's where the root canal problems and other related pains that we get that we can only come to an endodontist to correct occur, right?
Exactly, exactly. So we're actually taking the nerve out inside the root of the tooth, which is called the pulp.
And how is endodontics different from, say, general dentistry?
Yeah, it's just primarily going to school an extra amount of time. We go to dental school like every other dentist, but there's advanced training, like 2 to 3 years. And that's pretty much it.
So, and that's why you're an endodontist. That's why this specialty really focuses on these issues that you just touched on, as opposed to a general dentist who doesn't have those additional years of training like yourself.
Yeah, we acquire like a master's degree or a certification in that area.
And what would you say, Dr. Davis, are some of the advances that have taken place in endodontics that can benefit the folks out there that are watching?
Yeah, you know, root canals, it scares everybody, right? It's not so archaic anymore, you know, it's easier for the doctor and it's easier, you know, for the patient. So we've got terrific equipment, those being like a microscope. I use a microscope that enhances magnification like 20 times. So you can really see, you know, what you're looking at. We've got digital x-rays, which reduces exposure, I'd say about 80%. You know, people are often very scared about radiation, so this reduces it. And it's a teaching tool. So it allows the patient to see what the doctor is speaking about. So that's huge.
Yes, it is. So basically, your office here is obviously state-of-the-art, as you just mentioned, the technology that you have. And I take it that these advances in endodontics that have taken the whole root canal process to another level of virtually no pain to little pain at most, as opposed to that image we've had over all these decades of, oh my God, I need a root canal, and you're thinking excruciating pain, but that's not the case anymore.
No, and we don't even keep the patient in the chair that long because the instruments that we use have more flexibility than your old stainless steel files that we used to use. So it tends to go around curvatures, you know, very nicely. So it makes it more efficient for the clinician, you know, and less chair time for, you know, for the patient. And also the obturating materials, you know, there's so many more choices, and the anesthetic delivery also is has improved greatly.
So the advances in technology have really fueled the advances in endodontics.
Oh, absolutely. Absolutely.
And who would you say, Dr. Davis, would be a good candidate that can benefit from these treatments?
Patients that have excruciating pain, you know, pain coming out of nowhere, a tooth that is discolored, a cracked tooth, patients that have extreme sensitivity to, say, hot and cold, pain that's not relieved by analgesics, or they have to take analgesics, you know, either scenario. Like I said, cracked tooth, a patient that has swelling, or pain that travels, this pain goes up to my eye or on the opposite side, or I'm getting headaches. Those type of symptoms will definitely generate, root canal therapy.
And pretty much most, if not all of us, have suffered from some or all of those symptoms at one time or another in our lives.
Sure, you're going to, exactly.
Yes, put it that way. You're
exactly.
And what type of results can we expect from these treatments, doctor?
Well, the first few days after treatment, for some, not all, the tooth can be sensitive. Some patients have said, I didn't feel anything once I left here. You can't guarantee that. But if a patient's come in, swollen, in pain, they can expect a little discomfort. But nothing like what they walked in here with, and nothing that's not easily relieved by an analgesic over-the-counter pain med.
Is there any downtime that patients are looking at from the treatments you offer, Dr. Davis?
Most people go back to work right after the root canal is done. Now, there are cases, obviously, when we're doing a surgical procedure, when we're doing surgery in the office, I recommend that the patient do the surgery on like a Thursday or Friday so that they have the weekend to rest and, allow for optimum healing to take place. We feel like we always have to be working and this, that, and the other, but, it's time to relax and just let the body heal itself at that point.
And how long will the results last? And I know that depends on each patient and what he or she had done, but typically what is someone looking at?
Well, as long as they have the tooth properly restored with a crown or a proper restoration, and they're going regularly for their dental checkups, the tooth should function like any other tooth for a lifetime.
Now, you have a very unique approach from what we found in our research as far as helping patients relax and to minimize discomfort. And I just wanted to ask you, Dr. Davis, if you can please tell everyone about that.
Sure, absolutely. Well, our job here is to make patients feel comfortable. People would rather be doing anything else than getting a root canal. And they're already coming in the door fearful, of just the word root canal. And so our job, like I said, is to minimize that discomfort the best that we can. So we do offer nitrous oxide sedation to help relax the patient. But lately, I've been using essential oils in my practice, and I've gotten huge results with that. Very positive results from the kids to, of course, the ladies love them, and even the men are willing to try it. It's really awesome because what happens is that the essential oil interferes with the limbic system, working with the hypothalamus that impacts the physical and emotional well-being of the patient. So the results have been tremendous. I mean, I love them. I mean, it's nothing like coming in an office that doesn't smell like a dental office, that smells like essential oils. I mean, it's remarkable. I give samples out to my patients to take home with them. So they love that. They love that, They love the whole touch. They can really tell that we're very different than the norm.
Very, very impressive indeed, Dr. Davis. And you certainly have a wonderful spa-like atmosphere here as well. Not just the essential oils, but I think the whole ambiance of the whole feel when a patient walks in here it relaxes a person. I felt relaxed, and I'm not even a patient of yours when I walked in. So I think that's very powerful indeed as far as helping patients.
Thank you so much. Thank you.
We're now going to meet some patients of Dr. Davis and Davis Endodontics. Welcome, Kevin. It's a pleasure having you on our program.
Thank you, ROCCO. Thank you.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Kevin, by asking you if you can please tell us what brought you to Dr. Davis.
Sure. By the way, I'm very happy to do this for Dr. Davis, which says something about her. I had very severe tooth pain. My regular dentist was out of town, and she recommended that I come to Dr. Davis to see if I happened to need a root canal, which in fact I did.
So then you came here.
I came here.
And you had it done the same day?
But yeah, she dealt with me the very first day. There was practically no wait, which was I was thankful for because it was very, very painful.
And how long did your particular treatment take, the root canal?
It was done within the hour, I would guess, perhaps an hour and a half.
For the folks out there watching, what would you tell them about your experience with not only Dr. Davis, but also the staff here?
What surprised me was that the root canal is not painful. I had a long history, which makes me very, very tense whenever I walk into any type of dental office. I've had some very, very bad experiences, so I'm a big baby when it comes to tooth pain. And my tooth was hurting. And yet from the moment of injection through the procedure and then afterwards, I had no pain whatsoever. So I've heard terrible things about root canals, but in fact, at least with Dr. Davis, they don't hurt. So that's my key message.
Yes, indeed.
On my second visit, by the way, I didn't even I didn't feel myself tensing up as I entered the office, as I usually do. I didn't have myself see myself grabbing the chair arms and so forth. So that was the indicator of my comfort. And the staff is very, very professional, and the whole atmosphere is basically very calming.
Well, we're so happy to hear that. And you're absolutely right, Kevin. A lot of folks, that's why it's mentioned throughout time, oh God, I'm going in for a root canal.
Right.
And most people envision that pain and all that uncomfort that traditionally has been the case with root canal procedures. But there have been a lot of obviously advancements, and Dr. Davis is the best in what she does. And you came in here and there was no pain at all, and you were in and out, and you're relaxed even coming now to the dentist as opposed to before.
Well, maybe not to all dentists, but I certainly would be to Dr. Davis. Yeah, I have great faith in her. I'm very happy to endorse her. I have found just her, her entire technique, her demeanor. She's obviously expert, but also gentle in her procedures. So I have nothing but praise for her.
Well, on that note, we'd like to thank you, Kevin, for joining us, sharing some of your experiences, and being a guest on our program.
Of course.
Welcome, dentists. It's wonderful having you on as well.
Well, it's nice to be here.
Now, let me ask you what I began by asking Kevin, and that is, what brought you here to Dr. Davis?
Well, I was having some pretty serious dental problems. I had a tooth that had cracked, and I needed to have it resolved. It was causing me a lot of pain. I had, several years ago, I went to another endodontist, and I really wasn't happy with the service. And and the prices was just astronomical.
Not a good combination.
Not a good combination. So I started looking around, and I ran across Dr. Davis doing the same thing that basically I am doing right now, as she was describing her business and what she does, and I was really, really impressed.
Oh, so you saw her with one of her other interviews?
Yes, I did.
On YouTube, you
Yes,
said?
on YouTube, that's correct.
So then you came here to her, and tell us about what happened.
Well, I came to her. The office staff was strictly professional, really pleasant, nice to deal with. And when I sat down with Dr. Davis, it was such a wonderful experience. She's very pleasant. She's obviously she's extremely knowledgeable, and she solved my problem.
That's great, Dennis.
Yes.
And can you tell us about some of the treatments you've had over time?
Well, I've been having an infection for the past year and a half on my left side of my mouth, and it seems like nobody could find out the problem. Well, Dr. Davis has. So it's resolved, and I couldn't be happier.
And there's nothing worse than those infections, because they cause pain that comes on and off.
Yes.
Right?
That's
and
correct.
that's why you said it was about a year and a half.
Yes.
But yet, wherever you went prior to coming to Dr. Davis, couldn't identify the root of the problem, if I may use that
Yes, they
term.
couldn't find the root of the problem.
Yes.
And she did, and it's solved, and I'm so thankful that she's my endodontist.
And before we let you go, Dennis, for all the folks out there watching, what would you tell them about not only your experience with Dr. Davis, but the staff here as well?
Well, if you give her a try, give her a shot, you won't be disappointed at all. As far as I'm concerned, she's the best. The staff is so pleasant, so friendly, very knowledgeable, and I couldn't say anything better about them.
Well, you're obviously a happy man,
Yes,
and
I
that
am.
says a lot when there's a happy smile coming and leaving from a dental office.
Yes.
Because that's one of the biggest fears that people have.
Absolutely.
And to know you can come to an endodontist like Dr. Davis, where you actually have a smile, you relax, treats you like family. Obviously, you're very pleased with the work and the results. That says everything.
Yes, Dr. Davis is a very special person as far as I'm concerned. She's so friendly, she's outgoing, so pleasant, and she's just like you said, family. And she'll be my endodontist for life.
Well, on that note, we'd like to thank you, Dennis, for joining us and being a guest on our program.
My pleasure. Thank you very much.
Welcome, CHERYL. It's nice having you on.
Thank you so much. I'm glad to be here.
Well, we appreciate you coming down, and wanted to begin, CHERYL, by asking you if you can please tell us how long you've been a patient of Dr. Davis and some of the treatment or treatments that you've had done over that time.
Okay, well, I met Dr. Davis this year. Earlier this year, I needed to have a root canal done. So my dentist recommended that I come to Dr. Davis.
Okay.
And so I scheduled an appointment, and she was wonderful. I think the whole atmosphere of the office and it's just a very relaxing environment. It smells good in here. The staff is very friendly, and she was excellent.
And I understand also in your particular case that, like a lot of folks, there's a lot of anxiety and nervousness coming to a dentist, an endodontist. So I understand in your case that there's some essential oils that Dr. Davis
Yes,
has.
after the root canal, ROCCO, I had to go back to my dentist to get the preparation for a crown, right? And somewhere in there, something happened, not quite sure, but I ended up with an area back there at the top of my mouth that was a problem area. So I came back to Dr. Davis. Dr. Davis and my dentist communicated back and forth. I came back here, and she looked at it and she said, you know what? I have just the thing for you. And she pulled out a little thing of essential oil. It was called On Guard. And the thing that I found most surprising, that she applied it to that area, and immediately the pain stopped. I had been suffering with that for about a 2-week period, and I was doing the rinse that the dentist usually prescribes when you're having an issue. But when she put that on and the pain stopped immediately, I said, I've got to get some of that.
That was
In fact, I ran home and told my sister, you've got to get some of that too. So
There you go. So the essential oils, the On Guard,
yeah,
is
it's amazing.
really a wonderful solution here.
Absolutely. Took the pain away. The area started healing a lot faster. Within about, I want to say 3 days, that area was just, nice and closed up and feeling fine. So.
And it's been good since?
Absolutely.
That's
Absolutely. I can
great.
chew on that side. Everything's good again.
And before I let you go, Cheryl, for the folks out there watching, what would you tell them about your whole experience here?
My experience with Dr. Davis has been wonderful. I highly recommend her. You need a root canal done, you need any deep surgery done in your mouth, you got to come to Dr. Davis.
And as far as the staff goes here at Dr. Davis's practice, what would you tell the folks about your experience with them?
The staff is friendly and knowledgeable. And those are the things that you want when you come to a doctor or dentist's office. They're timely, so you don't end up sitting in the waiting room for, a lot of time. So I found the whole experience to be very refreshing.
Well, on that note, we want to thank you as well for joining us and being a guest on our program, Cheryl.
Sure.
You're
very welcome.
It was our pleasure. We're now back with Dr. Davis. I must say the patients very, very pleased with the results, and you're absolutely right when you mentioned how relaxed and comfortable they are here coming to you, which really says it all, as I mentioned earlier.
Yes, thank you.
Now, we're literally out of time, Dr. Davis, but I wanted to ask you, before I let you go, you and your practice, Davis Endodontics, here in the North Potomac, Rockville, Gaithersburg region of Maryland, have established a reputation for excellence in not only patient care, but really cutting-edge technology. It's really impressive, and I just wanted to ask you what you feel helps separate you apart from many of the other endodontists.
Well, I think my staff and I, really care about each patient, and they know that. We try to go out of our way to help them in any way that we can, whether it's, calling them a cab or, helping them find the bus route that they need to get on to go back home, or heck, even printing out MapQuest directions. There are some people that don't use the GPS. But, we're just helpful to them, and everybody likes to go someplace feeling helped. I know I do. So I try to give that same service, and they do too. So, I have a great staff. I couldn't ask for better staff. And it's just genuinely caring about people and their well-being. And they know that. They can see that.
Yes, they can. The patients that we met with today, not to mention others through our research, they love you and your staff. You treat them like family, Dr. Davis.
Exactly, yeah.
And that really is unique these days when you think about it. And I understand another unique feature that you all offer here, because your mantra is so much, your staff here, Dr. Davis, to really take care of the patient, go way beyond even the extra mile in so many cases, that you have a mission statement that you all uphold for your patients. Can you tell us about that?
Yes, we do. It's in our hallway for everyone to see. Our patient care team strives to provide the highest quality and most advanced techniques while empathetically listening to our patients' needs. Our motto is to treat patients with the same care we would expect to be given. ROCCO, we are so proud of the fact that the majority of our patients have a great experience at our office. They remember us the next time they need a root canal, even referring their family and friends. We get that all the time.
Very impressive indeed. You can't say that about everybody.
No, you can't.
And on that note, I'd like to thank you, Dr. Davis, for joining us, educating us, and being a guest on our program.
Thank you so much, ROCCO. It's been a pleasure.